An estimated 52% of women and 48% of men use some form of vision correction, whether it be glasses, contacts, or surgery. There are more than 1 million people who say they need vision correction but don't use any. So what's the best option?
These women both have 20/20 vision, but they achieved it in different ways. Claire Anselmo traded in her glasses 6 years ago and became one of more than 30 million Americans who wear contact lenses.
They were easy to use and, not as high maintenance as I guess I originally thought they were.
Jacqueline Wayland wore contacts until she developed a fungus and went back to glasses, but they were a burden. So last year, she was one of the 1.4 million Americans who underwent corrective eye surgery.
I saw perfectly like the next day I came in and had actually better than perfect vision.
But what about safety? A recent study compared the safety of contact lenses with vision correction surgery.
With this study, we can now tell patients that this is a very safe procedure, and in fact, maybe even better than what they're doing already if they're wearing contact lenses. But on average, the likelihood of a serious sight-threatening complication from contact lenses was 5 times the likelihood with LASIK.
But Dr. Andrea Thaw says the findings aren't that clear.
Well, what they were doing was comparing apples and oranges. They were comparing infection rates. With LASIK, the complications have nothing to do with infection. The complications have to do with quality of your vision, with that glare, with the halos, with poor night vision, with dry eyes, which can be debilitating the rest of your life.
Dr. Rosenthal says those problems are a thing of the past due to advances in technology and points out the complications from contacts.
Minor infections like corneal abrasions or scratches of the cornea, broken contact lenses falling out at an inopportune moment like when you're driving a car. Those are complications of contact lenses, and those happen fairly often.
There is also a risk of infections that doctors agree can be avoided by practicing proper contact hygiene. But Dr. Thaw worries about the long-term consequences.
But it doesn't stop your eyes from changing. It doesn't obviate your need for correction the rest of your life. And in fact, my patients who had surgery 5 and 6 years ago are all back in glasses and contact lenses.
As for the cost, many insurance companies cover some of the cost of contacts. Wayland likens the cost of surgery to what she'd spend on years of contacts.
And of course, it's always important to do your homework in choosing what option is best for you, and of course, consult with a reputable eye doctor. For more information, including how to find a doctor in your area, you can log on to our website at WNBC.com, click on News4You, then select our health box, and then select our topic of the month. And now we're going to check today's